fabulous day going. My name is Karen Van Unen, and I'm MPHA's board president. Not for much longer. I think at about 1:10 this afternoon, I will no longer be MPHA's board president, and I say that actually with regret. It's been a fabulous year, and you'll learn more about it. I'm also in my other job the Chief Operating Officer for Dotwell, which is a partnership between Cotton Square Community Health Center and Dorchester House Multi-Service Center in Boston. We are really, or I am, absolutely delighted to have you here today for our 2012 annual meeting. This year's theme is growing the political will for prevention and health equity. And we're very pleased to have Dr. Brian Smedley here as our keynote speaker. And I think we're going to be in for a thought-provoking and informative session when Dr. Smedley comes up for his talk. It is with good reason that MPHA embraced this theme today. On the local, state, and national levels, this past year has seen lots of intense activity with some incredible victories, but not without its challenges and scary moments. And I think you all will agree that last week's elections was such a moment. Massachusetts voters came out in record numbers, a true testament to the strong tradition of civic engagement here at home. This was no surprise to MPHA, of course, because no matter where we turn and who we talk to, we consistently get a resounding response and support of all of our partners, new and old, including you here today, who are ready and prepared to advocate on behalf of healthy communities. It is exactly these leaders, these activists, these passionate residents who stood in long lines to cast their votes, and I'm sure you were part of it. In fact, I have to share a personal note. I am such a believer in social justice and health equity, and through my work on MPHA's board and being part of the public health movement, I actually became a citizen this year, just so that I could vote. And yes, I voted. In fact, I ran into lots of public health colleagues at my voting booth, and I do have a number of pictures of me voting for the very first time ever. Such a simple step, but with huge implications. And I am absolutely proud to be an American citizen, and maybe even more importantly, an MPHA member. This has been an incredible year for MPHA. We passed the Prevention and Wellness Trust, the first of its kind. No news to you, and if it is news to you, please catch up. It's very important that this has taken place. The trust will significantly increase resources for prevention activities across the Commonwealth. Furthermore, our long-standing efforts to improve school nutrition also took place, and the new guidelines were implemented as of August. Although I will tell you, and I don't know if Karen Hacker, where she is, but I ran into her at our school where we were voting, and yeah, they had a bake sale going. We didn't complain, though, because it was for voting purposes. But with these new guidelines, nearly 1 million kids in the public school systems are getting healthy lunches. We also made headway in protecting state public health funding and promoting a stronger public health infrastructure. And through this process, we built invaluable relationships and partnerships with you and many, many others. And I truly, truly want to thank you for your support and hope that you remain friends and partners with MPHA for forever. Not even a long time, for forever. While on the public policy front, we achieved many victories. Organizationally, MPHA weathered its own transformations, but also achieved its own victories. And I am very proud to say that MPHA is stronger than ever. We welcomed our new executive director, Toby Fisher. I was going to say Johnson, which is one of my staff members, so it's the wrong Toby. Toby Fisher, who, this past September. Toby, with his long history of leadership and coalition building, public policy and organizational development, is well prepared and ready to take MPHA to the next level. Many of you may know Toby in his prior role as executive director with NAMI, the National Alliance on Mental Illness. The search committee took its time to find the right leader for MPHA. it was important to us to find that special person with a rare combination of skills, passion, and leadership that we firmly believed MPHA needed. We found that person in Toby Fisher. He's truly a proven leader, and we are extremely happy to have him join MPHA. I want to thank the search committee members for their hard work and tireless commitment to making this happen. Ed Markovitz, Ray Considine, Debbie Klein-Walker, Steve Bradley, and Maddie Ribble. Again, thank you very much. You made the search really an easy process. And a special shout out to HRIA, who made their offices and resources available to the committee and the process. I also want to thank the staff for hanging in there during the process and for stepping up to the plate during the transition. MPHA also welcomed a seasoned field director in Andrea Freeman this past summer. By now you know that MPHA's secret weapon is not our work to analyze policy or to file legislation, although these are very important, but it's building the connections and partnerships in communities across the state that allows us to advocate with one voice for the changes that we must have in place. Many of you may know Andrea already. Since as MPHA's secret weapon, she has been in your communities, offices, local coffee shops, or homes to engage you in MPHA's public policy movement. You should know her, and if you don't know her, please make sure that you will. MPHA is only as strong as our relationships, and we are so pleased to have Andrea's incredible talents in our camp and be part of the MPHA movement. Maddie, thank you for such a great hire. Although she just, I heard Andrea introduce herself as Maddie's eyes and ears on the ground, so careful. We have much to celebrate this year, but we also know that we must be prepared to defend our victories plus conquer new ones. There's much work to be done, and we must stay united to expand our power and influence as a community to impact prevention, health equity, and ultimately social and economic justice for everyone. We're very excited about today's program. We're very excited that you are here and that you're part of our partnership. And we hope that you will leave having learned something, having made connections, exchanged some ideas, and have been inspired to stay involved with the public health movement here in Massachusetts. Before I turn it over to Toby, I'd like to give a big thank you to today's sponsors, always important to do. Our platinum sponsor is Bay State Health. Thank you. Gold sponsors are Boston Children's Hospital, Health Resources in Action, Justice Resource Institute, Mass Nurses Association, and Network Health. Silver sponsors are Celtic Care Plan, Health Plan of Massachusetts, Mass Behavioral Health Partnership, and Tufts University School of Medicine. And yes, we also have bronze sponsors, which are the Association for Behavioral Health Care, Boston College Graduate School for Social Work, Northeastern University Master's Public Health Program in Urban Health, Mass League of Community Health Centers, and more advertising. Thank you, thank you, thank you. Learn some new things, get to know what's going on in our state. Would be fabulous if you could do that. And now I'll turn it over to Toby. Thank you all this morning.
So I'm Toby Fisher. I've got to meet a lot of you, and some of you I have not had the opportunity to meet yet, but I am honored to be here. To give you a little bit of background, I actually started in the early 90s in the human service industry by accident, trying to pick up benefits. I worked for a large provider of infant, which was providing housing for people coming out of state institutions. And I really fell in love with the work, and I fell in the issue of social justice, that people with disabilities could live productively in the community, and decided I had noticed that I felt that a lot of the clinics and human service agencies were either well-run clinically and not business-wise, or vice versa, well-run business-wise and not clinically. So I decided to go back to school, get a graduate degree in social work and in business, which is really just two completely different experiences, but I did it at Boston College, where I still teach, and I have interns that I work with almost for a decade now, and it's a true honor to do that. But what I was really a fanatic around social justice, and I really thought initially it was going to be around housing and economic development. And somehow I ended up at NAMI. You know, if you ever follow your career path, it doesn't go the exact way that you think it's going to go. But I ended up exactly where I was supposed to be. And so I spent 10 years with NAMI really building that organization. That organization now has 8,000 walkers that show up at a single event. It has probably had programs in every single one of your hospitals, community placements. They had in our own voice, family to family, that grew across the state. And I was very proud of that. And now I'm here at the Mass Public Health Association, and I'm very proud of that because I, again, get to use, I feel like I'm a social worker and not a policy person per se, because my job, I believe, is to organize you as a group. And I'm so honored to do that because what a lot of people don't realize about this organization, and even I didn't until I started, we have the minutes of this organization going back to 1933, and the organization started into 1890. For 133 years, this organization has been at the forefront of the public health issues of the era, whatever the issues were. And if you look at the drop in mortality as a result of public health leaders between the late 1800s and early 1900s, it was a dramatic decrease. And that was a direct result of the leaders involved in this organization and people like you committed to public health. So myself, though, as an executive director, I get to stand on the shoulders of somebody else before me. And that was Val Bissett, who was in the room. Where's Val, by the way? Just a wavy hand. Who just was, she's over there, way over there. I get to step on Val's shoulders. I really do, because Val, by the way, and I can honestly say, and I'm not being modest, I had nothing to do with the Prevention Trust. I didn't do one thing honest, it's true. I just was involved in another industry, and this was something that really Val, Maddie, the leadership of the board, and you did. So I get to stand on her shoulders. But the reality is Val got to stand on Jeff Wilkinson's shoulders. Right? So that's Jeff Wilkinson over there. So Jeff, who also had a phenomenal leadership and is still very interested. And you notice that these people are still in the room because it wasn't just about being a staff person, it was their commitment to the mission. And Jeff got to stand on the shoulders of Laurie Stillman, which is she's also here. Where's Laurie, by the way? She just left. I'll embarrass her in a second. And Laurie got to stand on the shoulders of Lynn Karsten, who is not here today. She still works in the field, the Brookline Health Department, and she was unable to make it. And Lynn stood on the shoulders of Helen Meltzer. Is Helen in the room yet? Helen is supposed to be coming here, so I'm going to reintroduce her when she shows up. Helen was the executive director from 1968 to 1988, give or take. And some may think she was the first staff of this organization, and she wasn't. It was actually Elizabeth Casso, who was hired in 1948 as an executive secretary. So you think about all the people that I've stood atop. And then the reality is the executive directors, I think, we get an unfair share or credit for the amount of work we do because the board of directors turns more often than the president's turn. But this organization has had presidents since 1890. It was actually the Association of Public Health Boards. And I have the whole list of presidents, and they were people, if you look in the original literature going back, I have records going back to 1933, and it talked about the leaders that led this organization were passionate advocates who were leaders in the industry of public health. And nothing has changed, except that we're bigger, we work on bigger issues. And I don't want to name call too much, but there's some people who've been in the room just to give you an idea. I'm looking at Myron, by the way. And actually, Myron was the president in 1977, and he hosted an event with Ted Kennedy, and Ted was a senior senator then, by the way. I mean, you think about that. But I just want Myron and Nathan to stand for 1 second, if you could. Please do, because you got to see this. This, to me, is truly special. Nathan is Myron's son. All right?
This is Nathan.
And I just have to acknowledge that, because I can rattle off all these accomplishments Myron's done, but to bring in another generation, and by the way, they're both passionate, not quite on the same issues, but talk to Nathan about capacity building of nonprofits. It's remarkable. So I could go on, and I will probably drop a few other names because there's some really remarkable people here. But I'm going to take a little bit of break because we actually have, and is this Helen Meltzer? I will stand up. I've been speaking to Helen weekly. I am a big history person because I believe the origin of the organization is really important. And the history of this organization is truly amazing. We've been at the forefront of every issue. We were talking about nutrition. I found references of nutrition going back to 1917. And it could be before, I just don't have the records. We were talking about cancer before anybody else, and one of the things this organization does is once it gets an issue more mainstream, it moves on to the next issue. Prevention Trust, it's no mistake, this is one of the first in the country. It's a remarkable achievement, and we're going to hear more about it. There are so many there, so I'm going to drop little factoids along the day because I want to shorten my presentation right now, because we have a special visitor who does need to leave and do the good work that he does. And to introduce him would be our President-elect, Steve Bradley, who is our incoming President-elect, as I said. He's Vice President for Bay State Health Systems. He is also a passionate advocate. If you hear him, if you want to talk to him, ask him about health disparities and racism and what we need to do about it. He's one of the most passionate people I've met on this issue, and I'm truly, what a perfect day that we have around our topic, and Dr. Smedley coming here today. But I want to bring up Steve Bradley to recognize the special guest. I'll let him introduce.
Good morning.
Good morning.
Well, I'm going to try not to punch any of these buttons on the computer here, because God knows what will happen. It's my pleasure today to present 2 MPHA Legislative Leadership Awards to 2 leaders that deserve the lion's share of the credit for drafting and building support for the payment reform legislation passed earlier this year. The bill now known as Chapter 224. We all know that Massachusetts has long been a leader in health care, but what is often overlooked is that most of the major health care legislation passed over the past dozen years, including Chapter 58 in 2006, all included significant public health provisions. But public health and prevention has never before been front and center in the way that they are now in Chapter 224. For their dedication and commitment to public health as part of this new legislation, I'm pleased to present these awards to my friend, Senator Richard Moore, who serves as the State Chair of the Senate Chair of the Healthcare Financing Committee, and to Chairman Stephen Walsh, who serves as the House Chair. Senator Moore, could you join me on recognize him for his efforts, and we'll make sure that his award is delivered to him personally. That everyone with a stake in healthcare would be both watching very carefully and working to influence this landmark legislation. Within this fishbowl and under intense pressure, they undertook this project. Senator Moore has long been a champion of prevention, and he told us right away that a focus on keeping people healthy had to be a focus of this legislation. Working together with the Senate President Murray, Senator Moore led crafting of a Senate bill that put public health right in the center of strategies to contain healthcare costs, dedicating significant new funding to aggressively address the most costly health conditions at their root by focusing on community prevention. In the other body, Representative Walsh, newer to the helm of Healthcare Financing Committee, dove into the issues with a seriousness seldom encountered, meeting personally with hundreds of interested parties, touring the state to learn about our healthcare institutions. Now, I know this personally because he came out and visited us not once, but twice out at Bay State Health in Springfield. In his meetings, he didn't just sit and listen, he engaged, asking tough questions and instructing his office staff to follow up to collect even more information. He was committed to doing this right and interested in exploring every reasonable idea that came before him. He engaged us at MPHA in detailed discussions of our proposal for a public health trust, how it would work, and what it would accomplish. As the legislative session wore on and proposals were unveiled, the pressure and scrutiny only increased. But the commitment to public health from our awardees never was never seriously challenged. When the legislature took its final vote on the bill in the waning hours of the session, it was Senator Moore and Representative Walsh who presided over the conclusion of this ambitious legislation, putting into place a variety of strategies to tackle the problem of health care costs more aggressively than any other state in the nation. And as MPHA set out to do in partnership with them 2 years ago, public health was right at the center. Please join me in thanking Chairman Richard Moore and Chairman Stephen Walsh for their leadership and vision and courage in promoting public health.
To all of you for this award, because having been involved in public health, actually having been a member of a local board of health when I first began my political career, because in the town of Hopedale, where I was a selectman, we were also the board of health for the first 2 years of that term, and then we ended up creating a separate board. But I've been involved in the public health field in that way for a number of years. As Helen would know, however, there's no substitute for experience. And it's important that you learn along the way and continue to grow in the process and understand the important role of public health. I think you've got two great leaders that will be taking the association on in this next year or so. With Steve Bradley, I've known for a number of years. He certainly is not unfamiliar with the State House, having been Chief of Staff to Senator Stan Rosenberg when Stan was particularly when Stan was the Ways and Means Chair. And if you know Stan Rosenberg, you know he is very much into policy as well as process, and did a great job this year again with the redistricting committee, where we again, unlike the House 10 years ago, in both cases we were not sued by anybody like the Senate plan. And so Stan does a great job, and Steve was a terrific help to him when he was in the Senate. And then Toby, I've known also for a number of years in his own advocacy role, particularly with NAMI. So they're both good people to lead this association and the movement to the next level. So I think we're off to a good start. I was just saying to Steve that really with the movement in healthcare, nationally as well as here, the role of hospitals, and he's been very involved in Bay State, and the role of the medical professionals are going to change, I think, somewhat dramatically, or at least the emphasis of their work is going to change and shift, because they're now going to be far more involved in the community than the hospitals have ever been, although they're all pretty much community organizations. And doctors haven't been as involved since they stopped doing house calls in the community as they were, other than individual cases which you can find around the area who have been involved in leading their own community's efforts. But in a much different way, all of them, all of the docs, at least the primary care physicians particularly, as well as the hospitals, whether community or teaching or specialty, are going to be much more involved in providing that coordinated and comprehensive care. And that involves, and if you're going to try to make it both good quality and reasonable cost, that does involve public health. We've got to keep people healthy. And I've said it over and over again, sometimes people chuckle about it, but it's, if you don't get sick, health care is pretty cheap. And so, the whole point is that we really need to do more in that regard. To keep people, because if you're going to keep the cost of overall care down, keeping them healthy, getting them to do the right things is going to be important. So because they have to be, and we have to help them understand that they are their own primary care provider. That if they do the right thing, they're not going to need, other than some advice and counsel and guidance, and then when they do get into some particular illness, the more professional levels of healthcare. So that's really the focus and what we wanted to do, since although we've been doing a little bit of public health in each of the 4 bills now that I've been involved in, from Chapter 58 in 2006 on through the 2008 and 2010 iterations of our further adventures into health reform. as well as the most recent edition. And so we try to continue to do prevention and wellness and public health as part of those, but it's probably never been as fully developed and funded as it's been in this one. And so the real key is going to be building this movement to the point where when the funding that we initially grabbed from various entities to fund the Public Health Trust, when they hope they'll not have to pay again, but who knows? But we need to find what's going to be the permanent way to keep that fund going, because that's just not enough money to do it, to get us off to a good start. But it's not enough money to do it over time, and we need to figure that out and do it in a way that people can feel that they're making, not being taxed, but they're making an investment in better health, and that's really going to be, I think, the key. I do want to recognize a good friend and a great colleague, and I think one of our great commissioners of public health who's with us today, who I think got some bad press, not deservedly so, because I don't think it was anything that he did or didn't do that resulted in what we're going to be dealing with in several areas, but a great public health leader, John Auerbach, who's there's a lot that's coming out of what we're learning, I think, actually, from an organization that went far beyond its authority to make money, and that we needed to figure out how do we get better oversight of that, and there was really a big gap between what the state could do and what the federal government was doing or not doing to provide that oversight. And the president has Senate president has just, there's only really one president. The Senate president has appointed me to a commission the governor's established to look at what are other states doing, and what are the kind of the best practices that should be in place. Not, the courts will deal with a commission dealing with that, and I suspect ultimately we'll make some recommendations on some legislation to change that. I think one of the things that we would like to see the federal government do, even though they're struggling with finding any money for anything these days, that just as, and I know John is familiar with this, with nursing homes, we have a program where we go out, and with hospitals too, for that, we go out to inspect, and the federal government actually pays a good part of that bill to pay for those inspections, and whether it's random or regular, both cases. And they don't really give us any support for this sort of inspection. And so I think getting them to be a partner with us, and the federal government doesn't have to do it all. We can have the people on the ground, but we need help making sure we get the right people and can afford them with the right credentials. So I hope that we can move in that direction so that it be a partnership between the federal government and the states on making and protecting the public interest in this regard. But I don't want to, you've got a keynote speaker, and I don't want to take anything from him, because I know he's got some important words to say to you this morning, but I do want to just share with you that we have established, I think, very pleased with the folks that have been appointed to the new Health Policy Commission. Most of you probably know Stuart Altman, who's been around even longer than I have, and certainly knows the health fields terrifically. And some great people that have been appointed to that commission, as well as continuing the leadership of what was Division of Healthcare Finance and Policy, now in our new MPHA, the new Center for Health Information Analysis, which will be independent and will provide quality information to all of us relative to the different health statistics and information that's available. And that's another area that I think MPHA needs to be direct input into that source of information, so that we're not only looking at hospital data and medical data, but we're looking at public health data and using that more effectively to guide public policy. So there's a lot to do. We've done a lot in the last year, and in the last decade even. Ever since we started the ride that Paul Revere started when he was president of the Boston Public Health Commission, and we're still riding, but we haven't hit the winner's circle yet. and we need to do that. And I think we're well along the way, but where we need to, there's still areas both in resources and in public understanding and education that are important to make this really the kind of place that we will have a healthy Commonwealth and ultimately, hopefully, a healthy nation, since they all do what we tell them. When we start, Mitt was on the right course, even though he didn't admit it. But now we've got the president who will actually implement Romney Care. Thank you all very much.
So I'm going to chop up what I was originally going to talk about. It says, what is my vision? And thank you so much for the senator coming, who I have worked in a number of roles. So what is my vision? And very simply, and I said this to the board, I want you to know, really did a rigorous process. I mean, I jumped through hoops and flips and all kinds, but I do that anyhow, by the way, so people know me, know that that's true. But even for me, I was like, wow, this is a rigorous process, and for good reason, because this is an amazing organization. And so one of the things I said to the board is if you go 1 degree outside, people really don't know the importance of the Mass Public Health Association. They don't understand the impact of good public health. And so I'm known for a loudmouth, if you will. And part of that's going to be celebrating what this organization is and shouting from the rooftop of what we do. And yes, it's self-promoting, but it promotes our mission and vision and protecting the health of the Commonwealth. And part of that is also protecting our accomplishments of date, the school nutrition bill, and we have to protect that. The prevention trust. I mean, if you think about it, we got a $60 million fund out of a cost containment bill that's supposed to save money. So, again, I can take no credit, but someone did something extremely brilliant because the bill was supposed to save money and we got $60 million. So we proved our point that prevention saves money. But we're going to have to protect that. I guarantee you we're going to have to protect that. And you know, long term we want to grow. You know, there's so many areas of public health, and it's been a difficult economy over the past couple of years, and this organization made some very strategic decisions, wisely so, to be focused and strategic and get results, and that we did. But there's a broad umbrella that over time I'd like to see expand. But I want to go back and celebrate just a little bit, because I think people in this room don't even know what a remarkable organization. The leaders in this room, you might remember, by the way, was the past president of MPHA. Debbie Klein-Walker was the past president of MPHA. Some of the board members, you know, and then there's leaders who went to Jonathan Fielding and Dr. Alonzo Plow, who went on to other parts of the country to be leaders. If those names ring any bells. There's so many. This is just a think tank and a do tank of good public policy that influence the entire country. But some of the people that are in the room today, I think I saw Elmer Freeman walk in, who was our past president. There's Elmer right there. And if I have any clue, and I was saying this, if I have any clue about racism, the true impact of racism, I mean, there's so many different levels. If I have a clue, I owe it to him. And who was past president of this organization. And they brought this whole Disability Action Network. Where are those folks? Are they here? So a whole crew. These are folks that he was the president of this board. If you don't know him, get to know him, but a true leader. Laurie Martinelli was the president of this board, who took my position at NAMI. Ray Considine, who's here, was president of this board. Harold Cox, I'm sure that's a name that rings a bell. Judith Curlin, who I believe is here, was also president of this board. Is Judith here? This Judith right there. Ruth Ellen Finch, who I do not believe is here, but that may ring a bell. And Karen Van Winden, who will soon be our former president. That's just to name a few. And if I skip the president in the room, please let me know. But there is one president that I skipped that some of you probably don't even know that he was president. I know some of you do, but some of you don't. And it's a person that we wanted to recognize. And actually, I'm just going to have him come up right now while I'm saying this, so I can say these kind words while you're with me on stage, John. Yes, if you could come up. I'm making this up as I go along a little bit, but I think I wanted you to be with me. John received the Paul Revere Award from the Mass Public Health Association. There is no higher honor at the Mass Public Health Association. And we could have got him another plaque. And he's done so much for this organization. He's done so much for public health here and across the country. Mass in Motion is a national model. But I've been to every event, I see you get so many plaques, and you deserve every single one of them, and you already got a highest award. And Kara Keenan, where is Kara, who's just an amazing staff person, and who knows this organization. Where is Kara? Somebody gave her a clap. She deserves this. Kara right there. You know, I said this to you too, how can I give you another award when we give you the biggest award? And Kara came up with the idea, you know what, and I really felt, you are part of our family. You're not just a leader, you are a leader, but you are part of a 133-year fabric of Mass Public Health Association. And you are part of our family, and what we thought we would do, rather than giving you another plaque on the wall, is to give you a dinner, and I understand that you like the 10 table. And we seriously, you know, as a this is your family. You were part of this as the president of the board. So the part people may not realize, he was president of the board. There's another president, and has a better leader over 133 years. One of our phenomenal presidents. Not you personally. But as a family member, we thought what you really would get another plaque is have a nice dinner with your family.
Thank you. Thank you, Toby. It does feel like family with the Mass Public Health Association, and frankly, it's always felt like family. And I've been in public health a long time, not 133 years, but a long time, and got actively, really appreciative of the work of MPHA when I was working first at the Community Health Center, then at Boston City Hospital, and then later at the Department of Public Health and at the Boston Public Health Commission. And so I would just say that I think MPHA is just invaluable, and that the work that has been done over the last several years that has really made this enormous difference. And you talked about just two things that I think are really significant: the nutrition, school nutrition bill, and this very strong component of Chapter 224. That has the $60 million prevention fund. Those are two things that I think had not been led by MPHA, they wouldn't have been there. We had great leaders like Senator Moore, but it really took the advocacy and the support and the resilience year after year to build the case. And so it's just such an important organization. And so I would just say, just for a few minutes, I'd say thank you to the leadership of MPHA over the years, and you've mentioned the people who were the executive directors. Thanks to the board. The board has just been, a phenomenal group of people. I was very happy to work at the Boston Public Health Commission and the Department of Public Health with, I think, just the best elected leaders when Mayor Menino and Governor Patrick, which supported public health, and they really listened, I think, to MPHA and were supportive of the work that MPHA was doing and thinking about how to translate it into public policy in very important ways. And I'm now, as people know, I'm now just about 2 weeks at Northeastern University, and I'm very happy that they, the MPH program, who just do terrific work, and Northeastern is going to be very actively involved in not just MPHA, but in the key public health issues that I think you're highlighting. And maybe I would just say, in closing, as part of a thank you, that I've particularly loved and been honored to work for the last 5.5 years. Before I was at Northeastern at the Department of Public Health, and there was a whole bunch of Mass Public Health people who are here who I'm particularly grateful to, but I just want to mention in particular Jeff Wilkinson, who, if I did one thing smart when I became commissioner, I thought, gee, well, let's get the leadership of MPHA and let's bring them into the Department of Public Health. And so Jeff has just done a terrific job. And two other people I just want to highlight. Georgia Simpson-May has just done a great job of making sure that health disparities among all populations become a top priority within not just the Department of Public Health, but in government. And so thank you, Georgia, for that. And it's been really my honor over the last 5 years or so to work alongside Dr. Lauren Smith, who has just been an incredible leader. She's been the person who really worked on making sure those nutrition standards got drafted and implemented. She did outstanding work on the H1N1 leadership. She's done great work on protecting childhood and injuries through, again, new regulations and legislation. And so in the Department of Public Health now, there just couldn't be a stronger and more far-sighted and effective leader than Dr. Lauren Smith. So I look forward in a new role to participating in MPHA. Now that I'm out of state government, I can lobby more, I can speak more freely, and I tend to use that to advocate for MPHA and advocate for the critical issue that MPHA has stood for. And again, I will be even stronger in terms of doing that because I will enjoy the meal from the certificate that you gave me, so I will be strong and well nourished. I'll eat very healthy foods at that meal. But thank you all very much.
So you actually did part of my job because you were segueing to Dr. Lauren Smith, who actually is now in the room and who is the acting commissioner of Department of Public Health, and she was the medical director and chief medical officer since 2007. I think most people in this room know her leadership, and we are truly honored to, I'm going to have Dr. Lauren Smith come on up and say a few words, and we are truly honored to have her. I do this, I had to come up while we start talking. First of all, it's an honor. First of all, I have not met you, so it's a great honor to meet you, and I've heard wonderful things about your leadership. And
From my mother?
well, you know, for a family, because you know, people feel like family guys. So I will introduce Dr. Lauren Smith.
Thank you. A couple of days, and I have to say this is a nice place to be and take a little breather after the last 48 hours. Many of you know I was down in Washington testifying, which we can talk about later if anyone has a sort of a, I don't know, a desire to make themselves miserable. But it was a truly an interesting situation. I'd never done that before, but I was very proud to do it because I think the department had a lot of very positive things to say, while at the same time, as I think you know, it has been a long couple of months and been a difficult time for the department. I'm sorry Senator Moore left. I think it's kind of interesting after the end of Senate hearings where fortunately for me, I guess, the FDA commissioner was getting a lot more untoward attention than I was. But I had to go up to Senator Lamar Alexander and Senator Hartigan because there have been a lot of statements about, you know, Mass Department of Public Health and sort of and things that weren't very charitable. And I, not knowing what the protocol is, I could flout it completely. So I just went up to them and walked up to, you know, we were probably not even allowed to walk back to where they are. I'm surprised that, you know, I wasn't arrested or something. But I just really needed to tell them that, in fact, public health in Massachusetts is doing incredible things. And that's essentially why I wanted to come here and be with you this morning. Because really, we have a department, as I know you know, of 3,000 folks, 100 programs, and up until 2 months ago, where, you know, the Boston Herald decided that we were the embattled, beleaguered department, we were, you know, the leaders in public health. We were the innovators in public health. We were where the federal government went to get best practices about a whole host of things. And so I feel like it is absolutely essential during, you know, this interim time that I have this role to change the narrative from beleaguered, you know, whatever the Herald wants to dream up. Sometimes I think they have a thesaurus and they just hit like bad words and then they just like slinging through it. It's maddening. But you know, to really change that narrative, to get people back to remembering why this is such a great public health department and why public health in Massachusetts is in fact the place where people go
to find best practices and to coach our leaders to take them down to, federal government. They wouldn't come here looking for good people if we didn't think we were doing a good job. So I hope with your help over the next several months I'm sure it'll take conscious effort, we can do that. We can really get back to talking about the numerous and very positive things that we're doing and the incredible accomplishments that the department has had over John Auerbach's tenure, which I'm glad, and I know it's maddening for him because he doesn't want to get any more of these awards and acknowledgments, but I think it would be really remiss for all of us in public health to not make those acknowledgments and not to make him as miserable as possible by telling him how great he is, which is, I know, excruciating for him. So I just wanted to take a few minutes, and I think I have just a few, to remind folks of some of the really impressive things that we have done together. And I think it's only fitting to start with talking about the fact that the department, under John Auerbach's leadership, specifically and explicitly made the elimination of health disparities a priority. Not just in word, but in action and in deed and throughout the entire department. And Georgia Simpson-May, who was one of the few people that I actually got to hire, so I can take full credit for that, has done a tremendous job in thinking strategically about how you work health disparities efforts throughout the department so that they are not, as I call it, ghettoized in one separate place where these are the three people that think about health disparities and everybody else does the rest of their job. That can't be how you effectively address health disparities. And so she's done a tremendous job with that and doing things in ways that aren't flashy, that aren't sexy. I have to say, I don't know, POS, the purchase of service, is not the sexiest part of public health. I'm sorry, it's just not. But for anyone who does that, sorry, it's just, it's not that. It's not going to be a made-for-TV movie. I'll put it that way. But the work that Georgia has done in instituting class standards into how we do our contracting is how you make health disparities work real. It doesn't have a fancy name. It's not going to have an institute, but it's how we make it real in our work. And I think that that's, incredibly innovative, and Georgia's been around the country talking about that. In terms of the work that we've done with the state's children and adolescents, I'm a pediatrician, so that, goes without saying that I've had a very strong effort in thinking about what we're doing with children and youth. Our childhood vaccination rates, I know are some of the highest in the country, if not the highest. Our WIC program and our early intervention program are also known for their national best standards. And we are fortunate to have a governor who has prioritized youth violence prevention as one of his strategic priorities. I don't know this for a fact, but I guess we can fact check it. I can't imagine there is another governor among the other 49 who specifically included youth violence prevention as one of his or her 4 strategic priorities. Not like buried somewhere down, but right up there with economic progress, etc. So I think that that's really impressive, and we've been able to sort of take that opportunity and run with that. And as John mentioned, another issue really has been around sports-related head injuries. And I haven't been watching much TV over the past few weeks. I've been kind of busy, but I understand that this past weekend there were 6, 7, 8 football players in the in the NFL who sustained concussions during games. Right? Finally, people are paying attention, and I think we have one of the best laws, and the regulations that we were able to do really has been very forward-thinking, and in fact, we have requests from other states to try to understand how we did what we were able to do. It goes without saying that Mass in Motion is an incredible opportunity with 50 cities and towns around the Commonwealth who are going to be part of this effort at making change at the community level, part of how people think about it. Part of that, as I know you know, is bringing sort of not the usual suspects to the conversation of health improvement at the community level, and I think that's been a tremendous work done. The chronic disease prevention and control work that the department is doing with some of the integration funds from the CDC, the tobacco prevention and control work that the department does, I know you know is stellar, and I don't know if there's any of these folks in the room, but the group that has especially been impressive to me is the youth group, the 84 movement, who had a Kick Butts Day, love that, at the State House, and they were some of the most impressive, articulate, engaged young people I've ever seen. So I would watch your back, folks, because they're gunning for your jobs, and they will do a tremendous job. I mean, these kids go before their state, their city and town councils to try to say, for example, make it so that pharmacies can't sell tobacco products. And they're, how are you going to say no to these kids? I mean, they know the facts, they're incredibly articulate, and to have a bunch of 10th graders come and tell you why you as an adult are falling down your job and you have to step up to protect us. It's pretty hard to say no to them, so they are incredible. HIV and infectious disease prevention, another place where I know that you're aware that our rates of new HIV infection are some of the lowest in the United States, which is fantastic. I'm thankful that through the work around prevention, screening, and appropriate treatment, that's been the case. I'm also thankful that we've had a hard frost, because now we don't have to worry about mosquito-borne illnesses, West Nile and Triple E, but the work that the department did and being in contact with local public health authorities and sharing information and providing resources, I think, was also quite impressive. I won't talk much about the healthcare reform, because you've heard about that a lot this morning, but I think that there is an incredible opportunity, as Senator Moore alluded to integrate thinking about population-based health into delivery of healthcare in ways that haven't really happened before, in an integrated way as opposed to a piecemeal way. And I know that MPHA will take up the challenge of thinking about how to do that in an effective and long-lasting way. That's an opportunity that we have that I really feel like we can't let go. And then lastly, I just mentioned substance abuse through the efforts of really sort of state-of-the-art office-based treatment and specialized treatment, inpatient and other treatment programs for targeted populations like adolescents and those who are required to be treated by court order. It's been very effective. I know that the opiate reversal program has saved many lives, and for folks who may not sort of like to think about it, that it somehow is condoning things, it's really hard to get people into treatment and recovery when they're dead, right? So you have to save people before you can help them into treatment and recovery, and the reversal, overdose reversal and prevention initiative is, I think, an impressive way of trying to think. You may not like it, but you got to move ahead and do it anyway. So I don't want to take up a lot of your time, but I felt like I just wanted to remind people of a few really great wins. There's many more. You could have a whole seminar teaching about how to lead a public health department in a strategic and sort of highly, not just competent, but thoughtful and creative way. And so the department that John has left in my novice hands, I will do my best to not run that ship aground. How many metaphors can I use? I've never actually captained a boat, so I think maybe I need another kind of metaphor, actually. But it's going to do fine. The department is strong, and I realized that and I'll just end with this little story. So as part of the hearings that we had to do related to the NECC, issue, the Energy and Commerce Committee asked for just incredible volume of records. You know, we ended up sending them literally like 10,000 pages of records and emails and stuff. So in the process of producing that, we had to sort of produce it and then review it and then get it sort of organized to send down to them. So for 3 weekends in a row, we had division directors, bureau directors. Georgia was there. She knows the craziness of this process to try to produce these records. And it, I don't know, there was some beautiful fall Saturdays and Sundays in there. And when Eileen Sullivan, who was the chief of staff, sent out an email, who can come help us? 7 minutes later, she had 15 people volunteer. 7 minutes. She counted. I didn't make it up. It's not even my normal hyperbole. And I think, you know, these are people with stuff to do. They work hard. They give at the office anyway. And then to volunteer to come in on like one of the few beautiful Saturdays to look through stacks of emails, that is the reason that I, had the momentary TIA and agreed to take on this role, because it's a department full of people who are committed like that. And when you have those kind of folks doing the kind of work they're doing, there's no way that we're not going to get through this better and stronger. And we will, we'll get back to being, the very impressive public health department that we all know that we are. And part of that is through our collaborative work with important organizations like MPHA. So thank you, and keep up all of your good work with us.
This organization is so committed to what is the next issue that we often don't celebrate what we did. And this is true today, because the next issue this organization has been talking about is health disparities. We've been talking about it a long time, but this is raised to the top of the priority list. And so what we're going to do today is very typical of what we've done in our history, is we don't recognize the fullness of our accomplishments. And we're going to do that again today with the Prevention Trust. So there's a flyer inside your folder. I encourage you to read it and get to know it. We were going to have Maddie Ribble, an amazing staff person who's been with us for a long time. People know Maddie. So, he being a good public health leader says, look, we have to get back on schedule and let's not talk about the Prevention Trust. But I want you all to at least read the flyer, get to know it. It was a remarkable, I think about $60 million in a bill that was supposed to save money. Somebody made a compelling argument, and we're going to have to justify that argument. I also want to point out there are, in fact, envelopes on your table. We hope that if you're not a member, you will join, you will consider donating. The way we run this organization is really through donations and grants. And I would be remiss to say that the Prevention Trust would not have been possible if it weren't for the membership, it weren't for the board of directors, it weren't for your donations. And I do ask a lot, and I always ask, people know that about me. But it were not possible if it weren't for the foundation support of the Boston Foundation, who was truly instrumental in 3 years of back-to-back support that made the infrastructure possible to get the Prevention Trust and other things done. Blue Cross Blue Shield of Massachusetts was instrumental. Tufts Health Plan, Harvard Pilgrim, Partners, Children, Bay State Health, and UMass Memorial are among, and there are other funders, we've talked about some of those, but those were some of the funders that helped with the infrastructure and the operations so that we could get that bill through and become a reality in Massachusetts. And I will again be asking them for money again, so you know. What I have to do is, Earlene, why don't you start walking up here so we, there's Earlene, okay. So I have the honor of introducing Earlene Achilles, who is a member of Place Matters. And Boston is one of 16 communities that has Place Matters in existence. And I have also not had the honor of meeting Dr. Smedley, so I'll be honored to meet you. But to do the introduction, and who knows this man well, and knows his leadership, and is working in one of those 16 communities, is Earlene Achilles to introduce Dr. Smedley.
I am so excited to be here to introduce the keynote for this morning. So as many of you know, Dr. Smedley is the Vice President and Director of the Health Policy Institute for the Joint Center for Political and Economic Studies in Washington, D.C. in this position, he oversees all operation aspects for this institution. And they have a dual focus to really look at health disparities and also look at policies and recommendations for long-lasting health equity issues across the nation and in local areas. So the Boston Public Health Commission is one of 16 communities for the Place Matters communities. Through Dr. Smedley and the Joint Center support, the Commission had the opportunity to come with other organizations across the nation to really bring together ideas, strategies to really start addressing these racial health inequities that we see across the nation. An initiative of the Boston Public Health Commission that truly benefited from this process is our Racial Justice and Health Equity Initiative, which includes a couple of areas that I want to share with you right now. It's our Professional Development Series, which is a curriculum that looks to align all the work of the Commission within a racial justice and health equity framework, and also build our collective experience and work to really address racial and health inequities across the city of Boston. Our next initiative is our Anti-Racism Advisory Committee, which is an internal committee at the Commission that is comprised of staff across all bureaus, which are looking at policies and practices within our institution to be able to develop recommendations to so that we can really work on ourselves. Oftentimes, we go out here and are looking to help others. And before we help others, we need to help ourselves. So we're looking to build our recommendations so we can provide within the Commission so we can make change internally. We also have the Commission's overarching goal to reduce overall rates and close the gap of racial health inequities within obesity, low birth weights and chlamydia among Black, Latino, and white residents across the city of Boston. We are also having our health equity granting model, which we ask grantees to partner with residents, which is so important, often are left out of the discussions, and partners, and really look at what are the racial health inequities that they're seeing within their communities. We ask them to address institutional racism and other social determinants of health. We also ask them to be part of a learning collaborative, because we can't do this work alone. Lastly, through this opportunity, we're able to develop a publication where we're going to share about health equity workings across the city within a newsletter. And the reason why we're doing this is we've had this conversation amongst our colleagues. We have this conversation on a national level within our institutions. But what we have to do better is relaying this information to our residents in our cities. So not only can they support the work that we're doing, but that they can actually carry the water for us. So we are creating this newsletter that really is targeting to sharing this information in a level that's easy to understand and that people could use to further their own public health work. And so we want to mention we are but one organization of many who has gained tremendously through the Place Matters initiative. It provided an environment to explore and identify strategies to address social, economic, and environmental conditions in communities that shape health. The Joint Center is also a leader who talks about the role of race and racism as a contributor to persisting health inequities that we see today. And the reason why I want to mention this, oftentimes when we're talking about health equity or health inequities or health disparities, or whichever of the words that you want to use, we often leave out the conversation of race and racism. And for us to really make change in our communities, we need to start having those conversations. And so, in this note, I really want to introduce our keynote today, Dr. Brian Smedley of the Joint Center for Political and Economic Studies, to share with us what it takes to sustain an equity movement that can produce real change. And I want to say, as you come up here, Dr. Brian Smedley, that you have been a great leader and visionary in this area. You had great forethought to bring great folks together to talk real conversations. Oftentimes we stay in the headspace, but you allowed us this opportunity to share practices that really can make community change. So please join me in welcoming our keynote for today, Dr. Brian Smedley.
The nation looks to this state for leadership nationally. I know this, and I can tell you this because even within Place Matters, the other 15 Place Matters teams, they all say, man, that Boston team, they rock. How do they do it? And so I want to say a bit about Place Matters and the Boston Place Matters team. First, thank you again for your time and attention.
How old were you when you became?
Eddie was 5 when I went there.
How old is he now?
He's 62.
So she started.
52.
He's 52 or 60?
Yeah, 52.
So 47 years. 47 years ago, she started working for MPHA. She was part-time.
It's just longer than most of the people that have been alive in this room.
And the other paid worker.
Helen was part-time, but she worked 60 hours a week. She was always working night and day. And in those days, we had 1,600 members of MPHA. In the 70s, when I was president, we had 1,600 members. And we had a meeting with Governor Dukakis and Ted Kennedy. We had over 600 people coming to that meeting. We had to move it because we had so many people coming.
Oh,
those were very exciting.
You've done a terrific job.
It was a long time ago, and I enjoyed every minute of it, I must say. I mean, looking back, there were times when it wasn't perfect, but I loved being a part of it.
Your father was a judge, wasn't he?
Yes, in New York.
Her father was a judge in New York, and very close to the mayor in Boston, wasn't he?
Yeah, he owned the Boston Braves. Do you remember that team? I don't think you're old enough to remember it.
We had 2 teams here. We had the Red Sox and the Boston.
Oh, I never was. American League and National.
Oh, I see. This was before you were born.
Yes, a lot of things were before.
My name is Jerosa Sylvain, and when I started, I was a bowl team, but now I am the college coordinator for the bowl team. But when I started, it was difficult because, as you guys know, we were trying to get pharmacies in Boston to stop selling tobacco products, and as you know, that was a big thing. And it took us about 8 years, and in February of 2009, we actually got pharmacies in all of Boston to stop selling tobacco products. And the reason why I share that story with you guys is because that took a lot of work, and it took us 8 years of hard work. I'm talking about protesting in the rain, in the hot summer days. Even in the winter, we were protesting. We were getting kicked out in front of people's stores, things like that. They were calling police on us. We had to get letters of support, letters, petitions signed, and different things like that. We had many community meetings, and we had to show these people this is something we care about. You guys are selling us products that are supposed to help us, but also at the same time you're selling us these tobacco products in your pharmacy. We felt like that was a big contradiction, so what we did was we got educated. We learned about the policy changes and how you can change policies within your community. We talked to city legislators and things like that, and finally, like I said, in February of 2009, they passed this law after 8 years. So that's just one of the many things that you guys can, just to show that you can do something, and we are doing something positive within the community, and we need you guys to support us as well. And I feel like I just wanted to thank you guys because you guys are giving us an award, and it's like we didn't really think that nobody cared about any of these things. And it's like when I started, I was a teen, and now look, I'm a college coordinator, and now you guys are like recognizing us, and it's something good. It shows that you guys kept us in your thoughts, and yeah.
Thank you.
Thank you.
I support kids trying to get arrested, but if I ever did, this would be the time. So thank you so much. And you can sit down, you can do whatever you want. I keep talking as I call Heather in the next group. But Abner, you got to come up here too, and the whole family. But you know, there was an award given some years ago to a sanitation worker, and Kara holds onto that letter, and it was just a man that he basically said, hey, I'm a garbage guy, what did I do? And this organization recognized him in the 60s for his work to make it a publicly healthier place to live in the community. So, to your point, people who don't think they deserve recognition are in fact those very people who do deserve recognition.
My name is Heather McMahon. I'm Executive Director of Groundwork Lawrence, and I'm also a board member of MPHA. And just like Toby has been saying all day, how important it is to highlight the great organization that MPHA is, it's really important to me to highlight how amazing Lawrence is.
Yes.
Yes. And Lawrence is amazing because of the people, the projects, and the programs that are there. And don't believe what you hear. It's an unbelievable, energetic, amazing place to work. And one of the reasons it is like that is because of Vilma Laura. So once you come up, we'll talk a little bit more. Vilma is a true community treasure, and I'm thrilled to be here to be able to present you with the Frontline Award. This award is reserved for someone who has had a significant impact on the betterment of the public health in their community through outreach, education, or direct services. And Vilma has done all of that. Currently, she is co-director of Women's Services at the YWCA of Greater Lawrence, excuse me, as well as a coordinator for the City of Lawrence Mayor's Health Task Force. She began her career over 20 years ago as a receptionist for the YW and worked her way up to become office manager for the YW's domestic violence program, and then the court advocate, the housing advocate, the family violence advocate, and now the director of women's health advocacy services. All of this time, she's been on the front line, working with victims of rape, domestic abuse, homelessness, to help them access the services and care they need to be safe and healthy. Not only has Vilma worked with people who have been the victims, she's also very skilled at working with the people who committed the crimes. She also works to prevent dangerous situations and illnesses and to undo racism and disparities it creates. She conducts community outreach to help underinsured, underserved minority women get screened for breast and cervical cancer, diabetes, cardiovascular disease, and works with medical providers to link services for eligible participants. For the past 2 years, Vilma has been the coordinator for the Mayor's Health Task Force, which is where I had the pleasure to work with her, in the City of Lawrence, which is now Chapter 11. Under Vilma's leadership, the group has grown tremendously, evolving into a strong grassroots coalition with 11 active working groups and subcommittees. And because of these accomplishments and so much more of what she's done, we're very honored to give you this award for your dedication, compassion, creativity, and tenacity. Thank you. To improve the public health in Lawrence. Now the good stuff.
My name is Adam Lauren, I'm her son, and every morning I see her wake up and I see her passion in her eyes. When she goes to work, I see how she's just determined to make our community a better place. All those things in the newspapers I see about the community are all that, but I can see like it's better than what it's said to be, and she's trying to make it like that. And I just love her. Get out. And I'm just proud to be her son.
Here, 1, 2.
So if anybody wants to, give me a hard time for allowing them to speak, that's probably not going to work over very well. So listen, in your folder, because we're going to move through the rest pretty quickly, because I want to give you time to talk and network at the end, and commit to getting done very close to 1:30 on time. Is in your folder there is the board list of people being nominated, so you want to pull that out, and I think we're going to recognize the people coming off, so maybe we have them start moving forward, and some people coming on, maybe have you start moving forward, and our president, who's been a dear friend, who's going to also be on stage and go the other way, is going to lead us towards the end of the day.
So my preference is actually not to do this, because how can anybody follow that act, right? Not act, passionate moments. It was certainly not an act, and really want to thank the awardees for all their hard work, and I'm very familiar with both teams' work that they're doing. So this is great. All right, so this will be my last task as president for MPHA of the board, and it's been a wild ride, a very interesting ride, and I've learned a lot, and I've been thrilled to be doing this work. And even though I'm stepping down as president of the board, I will continue to remain on the board. I hope you'll vote me in. But unfortunately, there are 3 members that are, their term is up. And I would love for Darrell Fox, if you're still here, to come up. Robin Clark, if you're still here, to please come up. And Monica Escobar, who I know is not here, correct? Whose term is also up. All 3 of these board members joined back in 2006 and have been outstanding leaders, uniquely contributing to the work at MPHA. Robin Clark actually chaired the nominating committee. Darrell has been part of the community health worker force in his role on the board, as well as his HIV work and public health work. And Monica was a committee member for the development. Thank you both very much. You've made my time on the board very easy, and you're going to continue to stay friends of the board. Believe me, we know ways to keep you engaged and roped in, even though you're no longer a board member. But thank you very much.
Thank you, Karen.
Okay. So the first one is Derek Brindisi, who is the Director of Public Health for the City of Worcester and the Town of Shrewsbury. Mr. Brindisi is responsible for providing direct oversight to a wide range of community-based public health, environmental, medical services, while ensuring health protection and improvement in Worcester and Shrewsbury. He's also the 2009 recipient of MPHA's Alfred Frischette Award reserved for young public health leaders. So, Eric, are you still here? No? He's gone. Okay. Just wanted to put a face with a name. Ray Considine is the president of Health Resources in Action. HRIA combats critical public health issues in partnership with governments, communities, scientists, and nonprofit organizations. And as you heard earlier this morning, he was a key member of the search committee that was part of helping us find Toby Fisher. And then last, we have Swapnil Maynard, who is the Director of Health Equity Programs with Brigham and Women's Hospital. Dr. Maynard collaborates with clinical and community partners to develop and implement innovative programs to eliminate health disparities related to infant mortality, cardiovascular disease, cancer, violence, asthma, and other chronic diseases. Neil, great. Thank you. Oh, Ray, you are still here. Sorry, Ray's here. So again, you can see by these bios that we're really adding some full force and knowledge and expertise to the board, so very exciting. Having the slate of nominations put before you, I'd like to ask for approval of the slate. All of those in favor, please raise your hands. Opposed? Abstentions? So moved. Steve, good luck. Thank you very much. I am actually thrilled to continue to be on the board and very much look forward to following Steve's leadership and being part of the board as we move MPHA to the next level with all your help. Thank you very much.
Well, I'm delighted to be your new chair, and I'm delighted that my first function is to thank Karen for the leadership, the outstanding leadership that she has provided to this organization, in particular, over the last 9 months. We had a challenging time. We had one of the most outstanding executive directors that I've ever worked with, in my 40 years in the social justice movement, in Val Bassett. Val, you're missed, you're loved, and we're glad you're still one of our biggest supporters here. So thank you for being here. Let's hear it for Val. Val left some big shoes. Now, she didn't leave all at once. She was kind enough, after her move to Westport, Massachusetts, which, if you haven't been there, is one of the most beautiful geographic areas in the Commonwealth, very close to where I grew up, so it's nice to have an excuse to go back home. She worked with us on a consulting basis and on a part-time basis and helped us keep the organization functioning as we conducted a very sophisticated and comprehensive search for our next leader. But having said that, all organizations need to have a leader that is so credible and so strong that when there are periods of uncertainty, the staff and the membership of the organization, the legislators, the funders, they can feel confident that even though we're going through a transition phase, that every I is going to get dotted, every T is going to get crossed. And that's what Karen Van Unen provided to us here over the last 9 months. Now, it's not like she didn't have a job of her own. She has a big job. She's the Chief Operating Officer. But you wouldn't have known it based on the amount of time that she spent, both at the headquarters of the organization and on the telephone and on email. So I want to personally thank you, Karen. I could not be taking over an organization that's in any better shape. Val, thank you for that. Karen, thank you for that. And we have a message from staff also. Karen, would you come up?
Hi, I'm Kara Keenan, and I'm the Membership and Development Manager at MPHA. And I'm happy to be here on behalf of the staff to thank Karen, because she was amazing. I'm emotional, so don't mind me. I tear up at commercials, everything. So Karen, for the last 6 months, was MPHA's unofficial interim executive director. And just to be clear, in case there's confusion, that is an unpaid position. So it's all the more reason for us to thank Karen. Like Steve said, she put together a solid plan with Val, a solid transition plan. But I think, above and beyond doesn't even say what Karen did. I don't know why I can't control this stuff. She was our co-director of operations. She was financial consultant. She was, a major part of our development fundraising team, as she always is. She made dozens and dozens and dozens of fundraising phone calls. Many of you might know that. She was sounding board. She was devil's advocate. She focused on marketing, strategy, things that I don't know how she found the time to focus on. And as if all of that wasn't enough, by my calculations, Karen hosted 6 MPHA committee meetings at her house.
Did I really? That many?
Yeah.
I'm going to start charging.
And for anybody who is lucky enough to attend one of those meetings, you can say, meetings, somehow it's easier to get work done around Karen Van Unen's dining room table. It just is. The food's amazing, and there may or may not be wine involved. So Karen, you were a tremendous, tremendous leader for MPHA this year, and you were the glue that held us together. And so on behalf of Maddie and Andrea and Diane and myself and the board, we're proud to present you with the Helen Meltzer Award for Extraordinary Volunteer Achievement.
Honestly, I loved every second of it. Couldn't have done it with the staff and the board. So thank you for doing this, but honestly, it's not just Karen. It was the staff and the board. And just so that you know, Karen, the search committee's coming over for dinner tomorrow night. They think it's a thank you dinner. I'll put them to work for us. Thank you, everybody. Thank you very much.
Thank you all for coming here to it's close to the central part of the state, and for supporting the Mass Public Health Association with your presence, with your efforts, and with your financial contributions. It's not the work that we do here together or that we celebrate together that's so important. It's the work that each and every one of you do out in your community, in your organizations, where you take the values that have underscored the work that this organization has done for over 100 years. And you take those values and you live them every day. You live them personally, you live them within your families, within your neighborhoods, within your communities. And I know that each and every one of you speak out and take personal risks when you see things that are going on that shouldn't be happening. So I want to personally thank you for that and encourage you to keep doing it. And in closing, I just wanted to make the following comments in hopes that they will amplify what our keynote speaker said today, and also put the Mass Public Health Association and its board and staff on record with the following commitment. So on behalf of the board and staff of the Mass Public Health Association, I want to thank you for the opportunity to support the important work of public health. I also wanted to be clear to one and all that many at the Mass Public Health Association are aware of the direct and irrefutable link between poor health outcomes for communities of color and 400 years of institutionalized racism. We see it every day in our emergency departments, in our community health centers, and in our physician practices. Illnesses and diseases that are well controlled in white suburbs, but ravage poor communities of color. Some of us are clear that this history of racism is embedded in every white majority-owned or controlled for-profit or not-for-profit business, civic organization, government entities, religious organizations, newspapers, television and radio stations, internet companies, real estate businesses, public and private secondary schools, colleges and universities, police and fire departments, hospitals and healthcare systems, banks and insurance companies, and unions. Every aspect of our American culture is built on 400 years of white folks like me benefiting from the use of free labor. Slave labor that built the early economic wealth of our country and propelled us ahead of our competitors across the world. Many of us are coming to understand that we cannot fix our broken cities or our dysfunctional school systems. We cannot successfully reduce crime or teenage pregnancy or drug and alcohol addictions, or heal our sick bodies or tormented minds and broken hearts, unless those of us who have benefited from this 400-year legacy of racism accept responsibility for undoing and healing racism personally, but even more importantly, institutionally, because it is through our institutions that we perpetuate this disease of racism. To this end, the Mass Public Health Association pledges to help lead the effort to undo racism in our cities, in our towns, and throughout the state. We will do this publicly. We will do this personally and professionally. We will collaborate with all of you. We will learn from you. And we are committed to making undoing racial and ethnic health disparities a high and visible focus of all the work that we do. I invite you to continue to join us in this work. Know that you're not alone. And thank you from the bottom of our hearts for supporting the Mass Public Health Association. We wish you a safe trip home. Thank you.